Hi, I'm Simon. I'm from West Sussex. I'm on a 2-year stride placement in Trinidad, Bolivia. I am a children's pastor and I also work during the week at a football outreach for the local community.
Hi, I'm Lauren. I'm on a 3-year stride to stay placement in El Alto, Bolivia. I'm originally from North Yorkshire and I'm currently living in Cochabamba because I'm learning Spanish.
Hi, I'm Andrew. I'm from Glasgow. I'm on a 2-year stride placement in Bolivia. I'm currently living in Cochabamba to learn Spanish, but I'm overdue to move to Oruro to work with prisoners and their families there.
So the situation in Bolivia is different from city to city. Here in Trinidad, we've been in quarantine for just over 3 months now. And for the first month and a half, there weren't any reported cases in Trinidad. People were following the rules, different things were in place, and it seemed to be going really well. And then all of a sudden, cases started to appear. And then once the first couple of cases appeared, the numbers just went up and up and up and up. And now we are known as the epicenter of Bolivia. So we have the highest reported number of cases in comparison to the number of people that live here. So even though we've been in strict lockdown for the 3 months, so you're only allowed to leave one morning a week to go out and buy the food that you need and go to the shops and get any necessities for your family. Despite that being in place, the numbers still continue to rise. We haven't yet hit peak, so it's very disheartening for people being in quarantine for just over 3 months, and things seem to still be getting worse. For my work, everything's obviously shut down. So the church is closed, so we've closed the children's ministry as well, and the football ministry outreach has stopped. So now I'm working alongside the church as we try and move materials online, as we try and create food parcels for people in the local community, and just find ways and means by which we can serve and help people in our local community during this really difficult time.
So I will be working with vulnerable women in El Alto, Bolivia. But at the minute I'm in Cochabamba learning Spanish, and because we can't go out, everything's online, but that's still been okay. But the project that I will work with has had to stop its programs, and it's quite difficult to reach out to the women and their kids because many don't have internet and other ways of communicating. And just in general, I think Bolivia's been good at trying to reduce the curve, but at the same time struggling with how to earn money when they can't go out. So that's been a challenge, but the government are really trying to work out the balance right now.
So the cases in Cochabamba and in Oruro too, they're still increasing there, and the capacity of the hospitals are reaching capacity now, so that's something to hear about and think about. And for me personally, I've not been able to go to Oruro, which was meant to happen at the start of April, but all the projects I would have been working on have stopped, and only one has just started back in the last week or so. So they've just started working with adolescents who are in prison right now. So that's one thing I might be able to start working on whenever I get to go to Oruro. But I've been able to work with the food bank here in Cochabamba.
In Bolivia, the poverty level is really high. Bolivia is one of the poorest countries within South America, and many of the cities are incredibly poor as well in amongst themselves. The healthcare in Bolivia isn't the best. It's not free, so you have to pay for it. So I can speak from my experience in Trinidad here. Hospitals just haven't been able to cope with what's been going on and the sudden number of cases as well. So hospitals have basically been shutting the door. And if people are showing symptoms here in Trinidad, they're having to be flown to a different city in order to receive treatment. This in itself has created problems because a lot of people within Bolivia just tend to stay in their city. They don't tend to move around. They don't tend to go from city to city. So a number of them have never flown before. So the idea of having to fly really scares them. The idea of having to leave their city to go to another city to receive treatment really scares them. And also, like I said, the treatment isn't free. It's really expensive. So a number of people are just choosing to not go to hospital, not to report their symptoms. And especially here in Trinidad, a number of people are just dying at home. As Lauren alluded to, everyone being out of work for so long, people just don't have the money to be able to pay for the resources. So you're asking people to pick between food for their families or medicine for themselves. And a lot of people are just looking after their families and doing what they can, and so just staying at home.
If you could pray for Bolivia as a country politically, there's been a lot of unrest before everything kicked off with COVID, so elections are due in September, I think, and there's still quite a lot of political unrest in the country, so prayers for that would be brilliant.
It'd also be great if you could pray for the hospitals in all parts of Bolivia, just to cope with the numbers and just to focus on the right patients, and for the healthcare staff to have confidence to keep going to their job even if they may not have the right equipment. And also in some parts of the country, healthcare workers have been treated quite badly, like pushed out of certain villages and like told they don't want to go in, and then throwing rocks at them in different places. So just like pray for the hospitals and for the people that work in.
Yeah, if you could be praying for my local church, our local church, as we work in this community that we're in. It's called HOWLING, and we're just looking at how we can best reach and faithfully serve people in a safe way during this really difficult time. We live in a really poor neighbourhood, and so a lot of people are out of work, are out of money, they're out of food. So we're just trying to find ways that we can faithfully serve them with food packages, support with the education of kids and healthcare and food as well. So yeah, just pray for wisdom and guidance in how we can best and safely do this.